everyone, my name is Jeong from Busan National University. It is a great honor to share our work in the Young Scientist session today. Our study is about participatory action research for developing assessment modules in Korean medicine. So we conducted a research to develop assessment modules for acupuncture, tuna manual therapy, post-diagnosis, and constitutional diagnosis. PAR was applied to emphasize collaboration between participants and researchers. So students, medical education experts, and standardized patients took part in the actual implementation of the assessment modules. And the evaluation was conducted using three main tools. So based on the PAR framework, we conducted 4 phases: planning, action, observation, and reflection. So in the planning phase, we developed assessment modules based on the suggestions of relevant academic societies. And during the action phase, the developed modules were implemented as examinations for third-year Korean medicine students. And in the observation phase, we evaluated the modules using the Roomba checklist, necessity and feasibility scores, and open-ended feedback. And finally, in the reflection phase, we revised and improved the modules based on the feedback. So this is how the planning and action phases were carried out. So this slide shows the examination rooms used for acupuncture and tuna manual therapy. And the next slide shows the examination rooms for post-diagnosis and constitutional diagnosis. So the evaluation results were reported both quantitatively and qualitatively. So first, we used the Roomba checklist, which stands for realistic, understandable, measurable, behavioral, and achievable. So all 4 modules scored above 4 in understandable, behavioral, and achievable domains. And acupuncture scored 4 or higher across all domains. However, the measurable domain showed the lowest scores in the other 3 modules. Next, we evaluated the necessity and feasibility of each assessment modules. So regarding the necessity, tuna manual therapy ranked the highest. And for feasibility, constitutional diagnosis received the highest score. Next, I will explain the feedback we received from participants. So medical education experts pointed out the need for a wider range of needle manipulations, pulse patterns, and constitutional questions. They also mentioned the lack of conditions to clearly observe hand movements and the need for better pre-exam instructions. And students raised concerns about whether professors could accurately evaluate performance, and standardized patients mainly focused on the authenticity and safety of the modules. In the reflection phase, we revised modules with detailed improvements. So for acupuncture, procedures are performed on separate mannequins for the arm, leg, head, and torso. And for tuna manual therapy, we plan to purchase flexible mannequins to safely include cervical spine tuna in future assessments. And for post-diagnosis, a pulse simulator has been purchased and been integrated into the CPX. And lastly, for constitutional diagnosis, the standardized patient pool was expanded to build a constitution-specific database. So finally, based on the findings of this study, these assessment modules are actually implemented as part of the clinical performance examination at Busan National University. So we believe that the developed assessment modules can be further utilized in the clinical skills assessments for Korean medicine education. Thank you for listening.